There's a specific reason your body has stopped responding the way it used to, and it has nothing to do necessarily with how hard you're trying. So I see this all the time. Patients who are genuinely putting in the work, they're watching what they eat, they're staying consistent at the gym, but the scale barely seems to budge. Their energy's flat, they feel like they've got inflammation in all of their joints, and they start thinking that the problem is just them. Just like those patients, I was in the exact same spot. I had chronic right shoulder pain, recurrent chronic lower back pain. I'd wake up every morning with stiff joints and didn't have any specific reason why they were hurting or anything that I did to make them hurt. But in the last 12 months, I've really been able to make all my pain go away. I've gotten the best shape that I've been in since honestly probably my late 20s, early 30s. And it isn't just by trying harder, although putting in consistent exercise and workouts is a big contributor, but it's also by finding 2 or 3 specific things that I had been missing my entire career up to this point. So one of these things is something I almost never hear people talking about correctly. Once I understood it, everything else that I was doing started to work in a way that it never had before. So I'm going to walk you through exactly what changed, why it mattered, and give you a starting point that you can use tonight. Most people think they're getting enough protein. I see this all the time when I ask patients how much protein they eat. And they respond by saying, I eat chicken, I eat eggs, I might have a protein shake. They feel like their protein needs are covered. But when their results stall, protein is often not the first thing that they're looking at. So one of the critical flaws is that what people defined as enough protein based on normal standards versus enough protein to actually change your body are 2 completely different things. So our food culture has also normalized portions of protein that are often way below what your body actually needs. So you could be hitting what the dietary recommendations, the traditional ones have been, but you're still dramatically underfed on the one factor that's going to probably have one of the biggest impacts on your results. So the threshold that most people are trying to eat to and reach, and the threshold that you need to be at to see actual meaningful results are often 2 different things, and there's a wide gap between those, and that gap is the whole problem. So you need to first understand why protein is important. Protein does 4 things simultaneously. It helps you build and protect lean muscle mass. It helps control appetite because it takes longer to digest. It takes more energy to digest. So that is going to help you eat less and lose weight. It also critically helps stabilize your insulin. Insulin is the key switch that your body uses to decide whether it's going to store versus burn fat. And it keeps you fuller for longer. So it makes discipline much easier. So the target you need to be going for is about 1 gram per pound of lean body mass. And for most people, that is significantly more than they are probably getting in an average day. So the key thing in your dietary approach is you need to anchor all of your meals around protein first, and then let everything else fill in around it. Patients who make this one change see body composition change way more dramatically than being focused on calorie counting, because appetite is going to regulate itself, your energy is going to stabilize, and the muscle that is the most critical for determining your metabolism and for your longevity and long-term health starts responding in the way that it needs to. So again, as protein intake goes up, hunger comes down. Insulin stabilizes, which is the critical thing for weight loss, and your body has the building blocks it needs to build and protect muscle. If you control your protein, everything else is going to get a lot easier. So protein's the foundation, but the second input builds directly on it and is often the most understood tool for anyone over 40. So let's now talk about the most studied supplement in the world that people over 40 often completely ignore. So creatine often was associated with just bodybuilders and guys in weight rooms trying to get big and jacked muscles. People filed it under stuff for athletes or bodybuilders, and often it was thought to be irrelevant for anybody over 40 who's not training for some type of bodybuilding competition or some type of athletic event. But honestly, that's a critical flaw because creatine is one of the most studied supplements on the planet. The research isn't new and it isn't really debated. What people miss is that creatine doesn't just help athletes. The same mechanism that supports muscle also is very critical for your brain and cognitive function. Brain tissue uses creatine. After age 40, both muscle and mental sharpness have to be actively protected. Your body isn't holding on to them by default anymore like when you were in your teens and your 20s. So the most studied supplement in the world is also one of the most ignored by the people who actually need it the most. The really important thing about this is that this isn't a complicated or expensive supplement or change to implement. It's a daily 5-second habit with an enormous amount of research behind it. So we need to understand that it's going to both simultaneously support muscle and brain health. You're going to increase the muscle's ability to produce energy. You're going to be able to meet and get more out of your everyday workouts, and it's going to help with faster recoveries. It's shown to improve memory and cognitive performance, especially under stress and fatigue. Really important, it's safe, it's cheap, and it's backed by a mountain of research. Standard dose is 5 to 10 milligrams daily. You don't need to cycle it. You don't need to load it. Just start doing it and be consistent daily. Taken daily, it's recommended to patients who are in a medical weight loss program, especially those who are doing resistance training, or just anyone in the population. Also, creatine plus consistent protein are going to be the foundations that everything else is going to be built upon. So the changes you can expect, you're going to hold on to more muscle while losing fat. You're going to get better performance during your training. Your brain is going to work better and have better cognitive function, especially under pressure. And it's going to protect two of the most important systems for long-term function. So protein and creatine are the foundation, but the third one is the input that most people are fighting against without even knowing it. And it's why their results are stuck, and it doesn't matter what else they're doing. They don't seem to be getting the results. Hey, if you could take a second to hit the like button and subscribe. We're trying to put out new content on a weekly basis. The next one's going to be worth your time, so check it out. So let's talk about why your body refuses to burn fat, even when you seem to be counting calories and working out on a regular basis. You eat less, you move more, calories in, calories out, the old teachings, but you're not losing any weight. And more importantly, you're not losing any fat. People would say, well, you know what? You're probably just eating more than you think. You're not accurately counting your calories. But, the problem is you just need to have more discipline and need to work harder. The key piece here is that thinking completely ignores the single most important factor in fat loss, and that's when insulin is chronically elevated from our modern diets that are very high in sugar, very high in carbohydrates. Your body will always be in storage mode. Insulin is the switch that tells your body to store fat or burn fat. And because we are in a chronic insulin elevated state with our modern diet, we are always in storage mode. That's how our bodies are wired under a modern diet, not in burn mode. You can be in a calorie deficit, you can exercise consistently, and you can see almost nothing happen because the hormonal environment is working against you. Interestingly, if you look at type 1 diabetics who do not have sufficient insulin, they can eat anything they want, as much sugar and calories as they want, and they cannot put on fat. That goes to show that it is not just calories in, calories out. The key thing is controlling insulin. Discipline is not the issue, hormone control is. So 3 questions you can ask yourself. Has your fat loss consistently refused to budge, even when you seem to be eating healthy and working out consistently? Do you feel hungry 2 to 3 hours after you ate? Has your energy been flat or all over the place, no matter how much you sleep? If any of those hit, insulin resistance might be what's underneath the problem. So the key takeaway is that fat loss is impossible if insulin isn't under control. This isn't about willpower or effort or discipline. It's about whether the biologic conditions for fat loss actually exist in your body. So controlling insulin is the first step in fat loss. We've seen this with GLP medications, and they have become a huge tool in fat loss. Skepticism early was based on either stigma, not really physiology. The research is solid on the impacts of fat loss with insulin control using GLP medications. But the critical piece is GLP medications can result in 50% of that weight loss being lean muscle mass, not just fat. And that's why it's critical that patients are monitored on these GLP medications and you're actually doing assessment of their body composition. So what we do here at Apre is we first do body scans before patients start on these medications to evaluate what their actual body composition is rather than weight. I want to know what their lean mass is, how much total body fat they have, how much of that body fat is visceral, meaning internal surrounding the organs versus under the skin. The visceral fat is the fat that is very pro-inflammatory, and that's really the thing that we want to get down. At the end of the day, it's not about getting a number down on the scale. It's about getting that inflammatory fat down. And that fat is the fat that is extremely sensitive to insulin. And as long as insulin is high, you're going to continue to store that visceral fat. So again, the real goal should be fat loss, not total weight loss. We need to get rid of that visceral pro-inflammatory fat because that's what directly increases risk of diabetes, heart disease, and so many other pro-inflammatory conditions. So the proof we can see is patients who have been stuck for years or yo-yoed up and down with their weight get on these GLP meds. And once they get their insulin under control, they start to see real meaningful results. It's not because they necessarily tried any harder. It's because the hormonal environment was finally allowing the effort of their work to see real results. So now finally, fat loss becomes physically possible in a way that it never was before. Your hunger is regulated, your energy stabilizes, and the work that you've already done finally produces the results it should have all along. So that's the insulin piece. Now let's talk about the thing that I was wrong about for years and the specific moment that changed how I looked at it. So for what seems like forever, I had chronic shoulder pain, back pain, joint pain. I just would wake up out of bed and feel like I was hurting. I'd try to modify my activities, work around it, maybe take some anti-inflammatories, and just felt like that was just a part of the aging process. But the reality is that I was treating the symptoms and I wasn't asking what was the underlying cause of the problem. And the reality is that I had this chronic systemic pain from chronic inflammation, not structural damage, not the age, and it wasn't irreversible. It was the inflammation that was causing the problem. And if I got that under control, a lot of the problems would go away. So in this case, the source was metabolic, what was being eaten and how my body was responding and processing it. So let's talk about numbers I never really measured and how taking a look helped change things. The shift wasn't necessarily trying harder. It's actually measuring and looking at the right things. So I kind of moved away from just making assumptions to actually looking at some data, stopped guessing and got objective measurements and information that I could use. One of those critical things was doing an in-body scan. Again, it gave me information about what my actual lean mass was, visceral fat, subcutaneous fat, and this was far more valuable than just looking at weight on a scale. Weight on a scale isn't really going to tell you anything about what's really going on in your body. We also used Hanoi, which uses analysis of your expired CO2 to look at what is actually happening within your metabolism and how I was actually processing fats and carbohydrates, what my baseline metabolic rate was, and recommendations for how to improve various aspects of my health. So once I was able to take that data and address the actual underlying problems, all of my inflammation got better, joint pain totally cleared up, and now at 47, I honestly feel better than I did when I was at 30. That's why that kind of same infrastructure of body scans and the PNOE were incorporated for patients, because I saw in real world and in my own example, the difference that one can achieve when they actually have meaningful data to base decisions. So the effort alone doesn't need to increase, but the precision does, and how we're going to target these things. So now let's talk about the actual daily protocol, exactly what it looks like in practice, and one place to start tonight. First thing is every single morning, protein before anything else. I eat no carbs in the morning. I will either have low-fat Greek yogurt with basically maybe some chia seeds, hemp hearts, maybe a little bit of blueberries. Try to get 50 grams of protein for breakfast. I actually measure portions, so I'm not guessing. Again, I know exactly how much I'm getting. I'm trying to shoot for 1 gram per pound of lean body mass. So for me, that's about 150 grams a day minimum of protein. I often am going to get quite a bit more than that. And it's really important you want to front load that into the morning. That's going to set and control your appetite for the entire day. High protein, and again, probably around 50 grams of protein for breakfast is a really good target, regardless of what your overall protein goal is for the day. Also want to get creatine in the morning. I get 5 to 10 grams a day. I don't cycle. I don't take it twice a day. I don't load. That's just how much I'm going to take every single day consistently. I also incorporate resistance training at least 3 to 4 days a week, and always working with progressive overload. If you're just lifting the same weights every single time, your body adapts and you're not actually building progressive strength. So you really want to constantly but slowly be increasing how much weight you're moving and how much resistance and challenging your body in new ways. Also, my diet is totally built around controlling insulin. I focus on whole foods, high protein, vegetables, a little bit, but minimal fruit, and totally avoid processed things like baked goods, sugars, ice cream, chips, anything that is really caloric and is going to spike my insulin. It just ends up creating more hunger and just makes it a lot harder to control. It's not that you can't eat those things. I just find that when I eat them, it makes it so much harder for me to control my hunger and then, just gets away from you. So track the composition of what you're eating, not your weight. So you need to also track the composition of your body. We don't care about what the total weight is on the scale. We want to know what's your lean mass versus your fat mass, specifically what's your visceral fat and getting that down to a healthy level to get that inflammation under control. The scale alone is not really a useful data point. And for surgical patients, protein intake before and after surgery is directly going to affect their healing, and it's going to lead to better outcomes and better results. So optimizing nutrition is going to lead to better muscle mass, less systemic inflammation, smoother recoveries, better results. So starting tonight, here's 4 steps that you can do. Number 1 is track your protein for 1 day. You don't need to do calorie counting and track your macros every single day of your life. It's not realistic, but at least for 1 day, track it just so you know how much you're actually getting and you're not guessing. Get some creatine. You want basic creatine monohydrate, 5 to 10 grams a day. Start tomorrow morning. Answer those 3 insulin questions from point 3 honestly. If 2 or more of those land, then it's worth investigating further. And number 4, go somewhere where you can actually find out what your body composition numbers are so you can know what your lean mass is, what your fat mass is, and those different systems like the InBody scan or DEXA will give you objective numbers for how much weight you need to lose. One thing that I see almost on a daily basis is when you ask somebody how much weight they think they need to lose, it's about half the number they really need to lose to get to a healthy weight. And we're not talking about a weight for aesthetics or looks. We're talking about a weight where you're going to feel good and not have all of that inflammation and risk of heart disease, diabetes, joint pain. So some of the key takeaways are the same habits that allow operating at the best level I have in my career at 47 years old are the same habits that are going to determine how well patients heal, how good their results are, how long those results last. And obviously, if you think about it, it's not a coincidence. We're talking about how your body responds to inputs. Ultimately, food is just fuel. Give it the right ones consistently, and what felt stuck starts to move in the right direction. This is true whether you're preparing for surgery, recovering from it, or just trying to feel the best that you can and the way that you think you should. So we've already got videos on this channel covering what 14 years of surgery actually taught me about decisions that matter most before anyone even steps into the operating room. There's a lot of overlap over what was just covered, but from a clinical angle, you probably haven't heard before, so check them out.